Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, and so that you can influence decision making, even if you're not a doctor or a nurse in intensive care. In last week's blog, I showed you how you and your family are perceived is directly linked to the care your critically ill loved one is receiving or not receiving in intensive care. If you haven't read the blog, you can read, watch or listen to it by clicking on this link. In this week's blog, I want to show you the 5 reasons why you shouldn't trust the intensive care team blindly if your loved one is critically ill in intensive care. If your loved one has been admitted to intensive care with critical illness, chances are that you are out of your comfort zone, and chances are that you feel, think or see that you have no control, you have no power, and that you can't influence any decision making. You are probably very nervous and anxious, and you probably haven't slept or eaten properly in the last few days, as you feel very vulnerable, stressed, challenged, frustrated and overwhelmed by the experience of having your loved one critically ill in intensive care. And depending on the diagnosis and the prognosis of your critically ill loved one, you may not necessarily feel like things are getting any better, and you may feel like things are getting worse. Furthermore, you also feel, think or see that with the situation for your loved one being so grim that you have lost control, power and influence, and other people are running the show and may deliberately exclude you from the decision-making process. It's a very bad and negative feeling to have, and there are many reasons why you shouldn't take the things that you see and that you and your family are being told by the intensive care team for face value. In fact, you should always make up your own mind, irrespective whether you have any knowledge about intensive care or not. More importantly, there are 5 distinct reasons why you shouldn't trust the intensive care team blindly, and the intensive care team, of course, has no interest in letting you look behind the scenes and give you any insights into the politics and the intrigue of an intensive care unit that may heavily impact on how the intensive care team may position your critically ill loved one's diagnosis and prognosis. Those 5 distinct reasons may also impact on the care and treatment your critically ill loved one is receiving or not receiving. So let's look at those 5 distinct reasons and why you should not trust the intensive care team blindly, and why you should always make up your own mind, irrespective of whether you are a doctor or a nurse. Reason number 1: the financial viability of your loved one's admission to intensive care. The hospital sector, and intensive care in particular, is a business, and it's often run as a business. Whether your critically ill loved one is privately insured or whether your critically ill loved one falls under a government scheme, your loved one's diagnosis will be assessed and weighted against economic criteria, and therefore the diagnosis and prognosis might get sold to you according to how the intensive care unit thinks your loved one's admission and treatment would make economic sense to the hospital or the intensive care unit. Therefore, you need to ask whether your critically ill loved one's admission would be eating into the budget of the intensive care unit, or whether they think they will be losing money. Or saying it differently, is treating your critically ill loved one financially viable for the intensive care unit? Is going through a lengthy and costly stay in intensive care in the best interest of the intensive care unit? And that's basically where the rubber hits the road. Unfortunately, this is not about your critically ill loved one. This is about the intensive care unit's agenda and their interests. And you and your family need to be acutely aware of this, because otherwise other people will be controlling you, your family, and most importantly, they will be controlling the destiny of your critically ill loved one. Reason number 2: other patients awaiting admission to intensive care. Know this: beds in intensive care units are a scarcity and are in demand. Not only are the physical beds a scarcity and in demand, intensive care staff, doctors and nurses are a scarcity and in demand as well. Therefore, the intensive care team has an acute awareness that usually a bed in intensive care never gets cold. If a patient is being discharged from intensive care, the next admission is usually not far away and around the corner. Therefore, if your critically ill loved one is in a situation where the intensive care team thinks that he or she may need prolonged therapy in intensive care with an uncertain outcome, the intensive care might tell you that the situation of your critically ill loved one is pretty grim, and they may suggest to you to either withdraw or limit treatment. The intensive care team may in fact be hesitant and reluctant to invest precious resources that they think would be better invested in other patients awaiting admission to intensive care. Again, you need to have a heightened awareness that intensive care beds are precious resources and in demand. Armed with that knowledge, you can then question why your critically ill loved one's prognosis and diagnosis may all of a sudden look so grim, whereas in reality the intensive care team doesn't want to invest the time, the money and the resources in the treatment and recovery of your critically ill loved one's recovery. Reason number 3. A negative and limited mindset that is holding the intensive care team back from achieving what's possible. This is a big one, and again something you need to be acutely aware of. After having worked in many intensive care units around the world, I have seen massive differences in mindsets in intensive care units, and I worked in some intensive care units where the intensive care team had a very positive, patient-focused and abundant mindset, where beating the odds was built in their day-to-day activities. On the other hand, I have worked in other intensive care units where a negative and limiting mindset was part of a generally negative culture, and unfortunately beating the odds was not part of their culture and mindset. Therefore, find out what the culture is in the unit your critically ill loved one is in. You can do so by clicking on this link to another article that I have written about culture in intensive care. Reason number 4. The intensive care team may think it's not sexy to treat your critically ill loved one. I know that's a strong statement to make, and I make it anyway, because again, my experience in more than 15 years intensive care nursing in 3 different countries has shown me that the culture in an intensive care unit is generally a very good indicator when it comes to how the intensive care unit positions your critically ill loved one's prognosis, diagnosis and the treatment that goes along with it. But what do I exactly mean by sexy? Well, by sexy I mean that the intensive care team will be looking at things such as the age of your critically ill loved one as well as family circumstances. Is your critically ill loved one 25 years of age or 85 years of age? Is your critically ill loved one going back to a loving family if they survive their ordeal in intensive care? I personally think that the age should not make any difference in the treatment, prognosis and diagnosis of a patient in intensive care, and again my experience has shown me that it does, and therefore you need to give your input and you need to counteract the intensive care team's positioning with your positioning that is stronger than theirs by being a strong advocate for your loved one. Reason number 5. Know that intensive care is a very complex area and decision making is rarely straightforward. Again, when you're talking to the intensive care team, you may hear differing opinions. Therefore, it's important that you don't get sidetracked by differing opinions. It's extremely important that you and your family have your own opinion that is relevant, and you mustn't be intimidated by the intensive care team. It's very important that you do your own research and that you're well informed and well prepared. It's also important that you stay positive. It's also very important that you gather plenty of knowledge yourself so that you and your family are in a strong position to have control, power and influence once your loved one is critically ill in intensive care. How can you get control, power and influence whilst your loved one is critically ill in intensive care? You'll get to that all-important feeling of power, control and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn quickly how to get real power and real control and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership now and download your free Instant Impact Report by entering your email below. In your free Instant Impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. You'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.